One of the problems we have in early intervention in mental health in young people is that we see young people coming into systems of care, into health services, with a kaleidoscope of symptoms, fragments of symptoms, different distressing experiences. And although we know they have a need for care, selecting the right type of care is a problem because we don't know exactly what the trajectory, what the future is going to hold for them.
So some of those outcomes might be the onset of a full threshold psychotic disorder, but of course there are other outcomes in this clinical population as well, such as non-psychotic disorders such as depression and anxiety, or remission of symptoms, complete recovery from symptoms, and so on.
So this research actually is incredibly important because it gives us a chance to predict who's at high risk of developing these outcomes, and also paving the way for interventions that can actually reduce the likelihood or the risk of progression to these outcomes.
So to arrive at these prediction models, we'll be setting up a network of clinics nationally and internationally to recruit this group of young people, and doing a range of different types of assessments in the group. So things like clinical assessments, neurocognitive assessments, neurophysiology, brain imaging, and so on, and look at how these different variables change over time.
We're looking at new theories, new statistical approaches, complex systems theory, artificial intelligence, and also bringing in a whole range of biomarkers to complement the clinical and other variables that we've actually looked at in the past.
We'll be able to test the prediction models that already exist in the field, so basically how well they hold up in this new large sample. And also, because of this whole range of data we've collected and the fact that we've repeated the assessments over time, we'll be able to develop these new, more robust prediction models. And once we've done that, we'll be able to see in another external sample, in collaboration with our partners, how externally valid these new prediction models are. So in other words, how strongly they hold up across different clinical settings, internationally, and in different samples of young people recruited.
Schizophrenia and psychosis, they're often described as the abandoned illness, the one that is not really taken seriously by society. It's been neglected, causes incredible suffering. It causes a very high level of disability, lost potential, premature death. So preventing that illness is absolutely #1 public health priority, and this research grant will take us forward into a new future where we're able to do exactly that.
So ideally, we'll be able to introduce clinical tools such as risk calculators that can be used in standard clinical practice, as we see in other areas such as cardiovascular risk, and other areas of general medicine, that allow clinicians to actually input a whole range of measurement data to predict outcomes or likely outcomes for individual patients that they're seeing, in their clinics. And also, and this is, I guess, the holy grail in this area, is to develop even more effective treatments for this group, even more effective preventative treatments.